Dr. Sharfstein, I'm going to cut to the chase. You were at Harvard undergraduate, winning the prestigious Hoops Prize. You did Harvard Medical as well. You were at Boston University Hospital. And what you did is you studied Fleming, you studied Salk, you studied Watson and Crick. You also studied Sharfstein. Guess what? There was no social media. How did guys like you and your profession adapt to virology and microbiology in the time of social media?
Well, we're seeing just how challenging it is. The misinformation that's out there, the fact that people are hearing again and again and again things that are just flatly untrue about the virus, just shows how powerful a force it is. We don't have that kind of partisan divide on penicillin, but we have it on a COVID vaccine in the middle of a pandemic.
Well, let's talk about who are the unvaccinated, Doctor, and what policymakers are looking to do about it.
Well, they're not all the same. I think that there are a couple of different ways of looking at them. One way is, there's still people who are open to getting vaccinated. They just want it to be really convenient. And I've met them. I've been out vaccinating. I see people who say, this is so easy because I can just walk down from my house. And so I decided to go do it, and I'm going to bring in some friends. And you think, that's great. We're here. That's why we're doing this big outreach campaign. There are other people who you really have to spend time with. And I've been talking to people at different workplaces, or just friends of friends call me, talk it over. Some of them decide yes after a conversation. And then there's some people who really are dug in that they don't want to get vaccinated. And I think that number is a large, I haven't seen recent polls on that. Initially, it was in the 10% range, but might be higher now with all this misinformation. And these are the people who, they get COVID and they almost die. And they said, well, what do you think about getting a shot now? And they go, I'm not so sure. I hear it might not be safe. And you got to scratch your head and go, like, how could you have that view, given that there are 150 million plus people who've been vaccinated safely and you almost died from COVID. So it's really difficult when you get there.
Doctor, we have to have a sensible approach to these conversations. And I think you're right to draw a distinction between anti-vaxxers and people who are just hesitant about taking a vaccine. These vaccines are being deployed under emergency use authorization. I just wonder if full authorization, so to speak, Josh, would help things just a little bit, maybe on the margin, if at all. Your thoughts?
I do think it would help, and I think it's important for the U.S. Food and Drug Administration now to be really explaining that process. I thought it's been important for a while. What is the difference? What data are they bringing in? What is the timeline? I think there are a lot of people who are confused, and I think just the we'll be really quiet until we tell everyone it's licensed approach isn't good enough for the pandemic. There should be more transparency. And I think that will affect some individuals who are waiting for that, but it will affect businesses a lot, particularly businesses who are wondering about requiring vaccination or really pushing vaccination for their employees, but are waiting to see what the FDA does.